powerful than the personal story, aka the human story. And we heard one earlier, but this one is really interesting that was presented to me. This next task will be focused on just that. Medically Home is not only transforming the hospital by exporting it to the home, but changing people's family life. So I'd like to welcome Richard Rakowski, the CEO of Medically Home Group, to the stage for this next presentation.
Thank you. Hi, everyone. So this device that we all use every day, it's getting a bad rap. A lot of us are believing that this is causing distance between each other and our families. I'm here to tell you a very quick story about how technology brought a family together. But before I do, I thought maybe I'd tell you a little bit of a personal story and background on myself. I grew up in New York in the 1950s and 60s. Both of my parents are Holocaust survivors, and both of them had a rough time adjusting to life here in the United States. When I was a very young boy, my brother passed away of a debilitating disease, and my mother was ill most of my childhood life. So illness, death, the shadow of the past was a big part of my growing up. At the age of 7, my mother had a bout of very extreme pain and was begging to see a doctor, but in those days it was very difficult to get a doctor to come to the home. I called our primary care physician in the middle of the night, and at 7 years old, convinced him to come to our house. About 15 minutes after he was there, the pain stopped, and I thought an angel had been in our home. And it had one of the most profound impacts on me as a human being in my life to see the change in state of my mom and myself getting relief from actually a healer coming to our home. Many years later, in 2008, after a career as an entrepreneur and engineer, my dad was admitted into the hospital in Connecticut with a medical error. While there and while I was looking over his care, and I have a deep background in healthcare, 3 consecutive medical errors took his life. That was a call to action, and in 2009, myself, a group of engineers and physicians, decided to try to create a new care delivery model that would actually liberate itself from institutions where patients literally are not necessarily safe, but more importantly, are not fully engaged in their own care. So we designed the care system where the home would be the center of gravity, but the challenge of the home, although it's the best place to actually age in place, where it's the best place to recover from illness, the problem with the home is it's distant, very, very distant from where the resources are that need to provide care for patients as they age and patients when they have acute illness. So the idea we came up with is, first and foremost, if the home is the best place to be, what if we could look at the home and the patient not as a patient, but in fact as a consumer. And as consumers have gotten used to having everything brought to their home with Amazon, have gotten used to knowing where their car is with Uber, have gotten used to talking to their grandchildren with FaceTime, what if we took that mindset and actually built a new delivery system where the home was center of gravity and the patient was no longer a patient, they were a consumer. So the challenge was, how do we build a micro-hospital in a patient's home? And that was about 8 years ago. There was a series of efforts, investments, clinical trial, and we've done that. And we've created an environment in the home that's safe and that allows us to actually monitor the patient. The previous panel covered some of the technologies that we integrate. The idea was to make the home tethered to a medical command center, staffed by clinicians 24 hours a day, 7 days a week, where the patient, their family would have access unfettered around the clock with the push of the button or talk to Alexa. I want to talk to my doctor. I want to see my care team. And that's what we did. The third and most challenging part of the idea was the supply chain. The clinicians in the field, oxygen, medication, meals, therapy, they were all remote to the patient's home. We had to configure, make it safe, make it reliable, and bring it into the home. Together, that configuration of technology, the command center, and the supply chain became the Seisha Continuum, our technology integration platform, which we launched in Boston on May 1st of last year and started treating patients. But that's not why I'm here. What I want to talk to you about, I'm here to show you a video of our first patient. And before I cue it up, let me give you some background. His name is Chuck. He's 93 years old. He's legally blind. He's mostly deaf. He's a cancer survivor. He was admitted into our program with pancreatitis and pneumonia. He was quite ill. He was 1 step away from the ICU. He had been hospitalized 4 times in the last 6 months before coming into our program. And he had difficult challenges at home, psychosocial challenges at home, and he entered our program. He was with us for approximately 40 days, and while we were with him and we earned his trust, all the technology that we used in his home were completely invisible to him. He didn't even know there was technology. He didn't know all the things that were being done to monitor his care, his vitals, his communication. And a remarkable thing happened towards the end of his care, which was he was estranged from his family, and as a result of the care that we gave him, we reunited his family. So I'm going to go to the videotape and show you the story of Chuck.
So if you had a choice to go to the hospital again or to stay home with Medically Home, what would you tell other people to do? Would you tell them pick the hospital?
I'd tell them forget the hospital.
You'd tell them forget the hospital?
Yeah.
Why wouldn't you want them to go to the hospital?
Because they get better care at home.
Medically Home is the idea that a patient who is sick at home, instead of having to go in the hospital and be in an unfamiliar, scary environment, can actually receive excellent hospital care in their homes. Chuck's story, it's amazing that he was our first patient. Dan called me and said, I've got this guy in the office and he's been hospitalized a bunch of times this year already and I don't want to send him back.
When he had been in the hospital, we thought that would be our saving grace.
But it was just a block everywhere we went. You try to help advocate for someone that's legally blind, hard of hearing, in his 90s, that won't fight for himself anymore, and you kind of hit a brick wall and they send you home. We always said that there was angels surrounding this program. We could press a button and say, he looks a little off right now, and you'd get the nurse, you would get the doctor.
We were able to reconnect him with his family, his daughter and granddaughter, and the rest of his family, and that was amazing.
They were able to see a little bit more of what our family had seen. I'm sorry, I'm getting a little emotional.
Yeah.
He's a yes and a knower.
Yes.
Yes.
Yes. Yes.
Medically Home, to me, is just the beginning. We've shown that we can successfully admit patients to a hospital in their living rooms.
But we still can't stop crying.
I know,
We're
so
trying.
that's what, it's like, oh my God, miracles happen.
So here's the end of the Chuck story. 42 days into our care with him, his daughter, Marcy, called and said that Chuck would like to separate from his companion of 20 years, who was 20 years his junior. There was a lot of tension and strife in that relationship over the years. And a lot of the hospital admissions that he had most recently were due to issues with her. So believe it or not, we went and intervened with the family and moved Chuck to a new home and a new life, reunited him with his family. Chuck has not been back to the hospital in now 7.5 months. His health is perfect. He's 94 years old. And it's a remarkable footnote to a story where the technology was pretty significant that enabled all this, but it was invisible. So the one message I'd love to leave you all with is, while technology is awesome, and it enables a lot of advances to care, what really matters is the humanity that we all feel for one another. All of us want to be home when we're not feeling well. All of us would like to age at home. None of us would like to be institutionalized and anonymized. And if technology can be integrated in a way that allows that to happen, it's a pretty awesome thing. Thank you very, very much.